So today we're going to dive into something called psychodynamic therapy. This is an approach that's all about going way beyond just surface level symptoms to create some really deep, lasting change. We're going to break down what it is, how it actually works, and see how it's used in a real world setting.
I love this quote because it really gets to the heart of the matter. If you've ever felt like you're just slapping a Band-Aid on a problem that just keeps coming back, well, this whole approach is about digging deeper to understand the roots of the issue. The goal? A much more permanent solution. All right, so here's the path we're going to take today. First, we'll talk about why we even need to go deeper than a quick fix. Then, we'll get into the core ideas of psychodynamic therapy, see how it's put into practice, and finally, we'll walk through what it looks like to get started. Now, chances are, if you're watching this, maybe you've tried other things, and you just feel like something's still missing. You might recognize that what you're really looking for is something more robust, more long-term than some of the more common quick-fix behavioral therapies out there. This approach is really for people who are genuinely curious about themselves, about their inner world. It's for those of us who are ready to really invest our time and energy into therapy that gets you results that actually stick. It's for people who aren't just asking what is happening, but are ready to explore the why. And that brings us right to the core of our topic. So what is psychodynamics therapy anyway? Let's break it down. At its heart, psychodynamic therapy is a scientifically backed approach that's really centered on the relationship you build with your therapist. The goal isn't just to manage your symptoms, it's about exploring those long-standing patterns in your life to understand you, the whole person, in the full context of your life and your history. So how does it all work? Well, it starts by exploring these deep-seated emotional patterns, helping you make sense of your inner world, all within the safe space of that therapeutic relationship. And it's really cool because it combines what we call top-down methods, that's your thinking and conscious thoughts, with bottom-up methods, which are all about your body's feelings and sensations. And this isn't just for individuals. This comprehensive approach works wonders for couples and even whole families. Now, this kind of really deep work, it doesn't just happen in a vacuum. So let's take a look at how one practice, NK Psychological Services, puts these ideas into action. They've built a whole philosophy around both individual courage and the support of a professional community. In their model, the therapy journey is, of course, deeply personal for you. But here's the key. The therapist isn't working all by themselves. They're actually part of a collaborative team, and that creates this really unique and powerful support system for you. It really boils down to two key ingredients. On one side, you have your own courage, your willingness to be vulnerable and to really explore your inner world. And on the other side, you have the collective wisdom of the entire clinical team. Because the therapists regularly consult with each other on cases, you're not just getting one expert's perspective, you're getting the benefit of many, all while your confidentiality is strictly protected. Okay, so you do all this deep work. What's the payoff? What are the results? Let's talk about what achieving that durable, meaningful change actually looks like in real life. This particular practice is set up to provide what's called wraparound support. What that means is they're able to work with pretty much everyone, individuals, both adults and kids, couples, entire families, and they even offer specific guidance just for parents. It really shows you how these psychodynamic ideas can be applied way beyond just one-on-one therapy. And the team's expertise covers a huge range of issues. We're talking about everything from the complex dynamics and relationships to getting to the bottom of depression and anxiety to processing trauma and even navigating neurodiversity like ADHD and autism. In every case, the goal is always the same. Look beyond the surface. So if everything we've talked about is resonating with you, you're probably wondering, okay, how do I start? Let's demystify that. We'll look at a typical intake process, which is really designed to be super clear and to make sure you find the absolute best therapeutic fit. A really thorough process usually involves a few key steps. It kicks off with a brief phone call just to make sure the practice is a good match for what you need. From there, you'll have a much more in-depth intake appointment with a senior clinician. And based on that deep conversation, they make a really thoughtful match, pairing you with a therapist whose specific expertise is best suited for you. It's all about starting the work on a solid foundation.
So let's leave you with this to think about. When you reflect on your own life, your relationships, your inner world, what are those long-standing patterns that you are truly, genuinely ready to understand? That right there, that question is a powerful first step on the path to real change.